And so the way that the submission we framed it was that the initial kind of section was about some of the broad concerns that we had around the COVID response as a whole. So those included the suppression of dissent, looking at the mandates and the impacts on free speech of those mandates, the communication strategies. So we've described that as one-way communication. And the behavioral messaging versus informed dialogue and some of the prompts and nudges that we saw used. So those were the broad concerns. Then we looked into the specific concerns of the professions. The healthcare one is by far the longest and had the most to it. So with that, we looked at the regulatory overreach that we were seeing from the professional bodies and how that undermined the system that it was supposed to regulate. We looked at how professionals were punished. We looked at worker distress from people who were within these professions unable to discuss the concerns that they held as professionals with the patients in front of them. And we looked at some of the enduring damage to some of the key pillars of healthcare that we see as being important. With academics, we looked at the ways that the government's response contravened academic freedom, which is obviously a very big concern of the Free Speech Union, especially at the moment, the punishment of professionals within that space and the long-term effects. And then with teachers, we looked at the suppression of alternative perspectives, so not allowing any different kind of ideas to exist within school environments and the behavioural prompting that some teachers were experiencing to share the public health message in their own spaces in a way that we saw as being quite inappropriate. So yeah, that's the overview of, I guess, the approach and how we went through the different concerns that we have.